Now, I've always been very sporty ever since I was a kid. I exercise as much as possible.
37-year-old Trishna Baraja grew up playing field hockey around her hometown of Marlow, southwest of London. In 2008, she was diagnosed with relapsing remitting multiple sclerosis.
I tried to build up strength so that if I was to relapse, and for example, it might affect my mobility, I want to know that I'm falling from a greater height.
In 2015, Trishna's advocacy work for MS landed her a coveted spot on the popular BBC programme Strictly Come Dancing.
Probably the biggest platform we've ever had in the UK to raise awareness about MS on a national scale and on a prime time television programme that is a household name. With Zumba, you can do it at your own pace. So when I'm having bad days, I'm still able to do it. If I was, for example, to have an MS relapse that might affect my mobility, I could do Zumba from a wheelchair. You don't know when your next relapse is going to be. You don't know how long it will last. You don't know what part of the body it's going to affect. You don't know how severe it's going to be.
Dr. Gavin Giovanoni treats Trishna's MS at the Royal London Hospital Barts Health NHS Trust.
In the majority of people, relapsing remitting. And so the attacks can occur at variable rates, different sites, and the symptoms relate to the part of the nervous system that's affected. And the relapse rates go down with time, so it's very difficult to actually predict when somebody's going to become active or inactive. People, when they get diagnosed, already have neurological deficits. It's usually subtle cognitive impairment, and within about 10 years, about half the population are unemployed. This is before physical disability. So that's, at a society level, it takes people out of jobs. It's progressive, so they become more disabled. The quality of life drops with disability, and you can imagine what the impact's like.
Fatigue is overwhelming. It takes over your entire body and your mind. It means that when fatigue hits, I can't function. I can't think properly, I can't speak properly because I can't form the words, I can't form coherent sentences. Even the thought of, for example, going for a shower or getting dressed means that I can't manage. I rely on a great deal of support from my family.
So the average age of onset of this disease is 30. It's between 29 and 32. I say that because women get it slightly earlier than men, about 3 years earlier.
Dr. Giovanoni says patients like Trishna represent an increasingly common profile among relapsing remitting MS sufferers. The disease is spreading more rapidly among young women than any other group.
Worldwide prevalence, the estimate is between 2 and 2.5 million people with multiple sclerosis worldwide. That's probably an underestimate, and the reason why I say that is because the incidence is going up in women more than it is in men, and the increasing sex ratio is actually an indirect marker of an increasing incidence. And we're seeing the sex ratio going up with each decade. So in the UK now it's close to 3 females to 1, and in some parts of the world it's 5 or more women for every male. And so that in itself is telling us something about this disease. Something's driving an increasing incidence in women, but not men. What we're seeing is increasing incidence across the Western world. What's driving that increasing incidence, we don't know. So there's lots of things happening in the environment pumping it down. Some of us think it's due to vitamin D deficiency. We know the disease is more common the further away from the equator, and there's this latitudinal gradient. And so living in the UK, we're in a high prevalence area where the incidence of the disease is about between 600,000 and 900,000, and the prevalence is around 125 to 150. Just go to Scotland, and you're doubling that. It's close to 250.
80% of patients who have relapsing remitting MS, like Trishna, will go on to develop secondary progressive MS. When the disease changes course, its attacks become unrelenting and disability becomes more severe.
The other thing is a majority of the disease occurs at a subclinical or an asymptomatic level. And at that level, the disease is causing damage, and the damage accumulates over time. And then when people run out of what we call reserve, which is what's responsible for them compensating for the damage, they enter the so-called progressive phase of the disease, and that's where the disease becomes much more predictable, because most people in the progressive phase continue to deteriorate at a steady rate.
I worry that I might not be able to work. I worry that I might lose my independence. I worry how I'm going to cope with that, because I still want to be able to live a very positive and happy life.
People are living a relatively normal life expectancy, but with disability. Because it's a disease of the brain, it affects personalities. There's a much higher incidence of divorce or splitting up from partners. Suicide rates up by between 2 and 7, depending which studies you want to quote.
For Trishna, her advocacy work for MS awareness helps her stay focused on the positive. Fighting back against the disease motivates her to keep moving and to keep dancing.
Doing Strictly was very much about smashing stereotypes. There is very much a stereotype that everybody with MS must be in a wheelchair. And to get that understanding from the non-MS community, that MS affects people in different ways, that there's many invisible and hidden symptoms, was absolutely phenomenal. When it comes to being diagnosed with something like MS, in order to move forward in your life, it's about thinking of how you can do something rather than reasons why you can't. It's about adjusting to new normals, and it's about saying that your life does go on.
Hi, my name is Kelvin, and I work on the team that creates the content that you've just seen, MedscapeTV. If you like the content and want to see more, click on the button to the right and it'll take you to the full series.